Hello, everyone. My name is Ola. I'm the instructor for today's session, which is about dyslipidemia and the anti-hyperlipidemic medications. This is a very important chapter as if we get to know what is a hyperlipidemia and how to treat that condition, that will actually give us lots of information about how to save the patient or prevent further complications and future cardiovascular diseases. And it's only because of that dyslipidemia is a modifiable risk factor of cardiovascular diseases. And we all know that cardiovascular diseases is actually the second cause of death in Canada. So it's a very, very important condition and very important chapter to know about. So how can I help a patient who has a high cholesterol levels? Does he have to take medication right away, or we can maybe to start with some lifestyle modifications in order to help him or reduce the high levels of cholesterol? There are for sure some non-drug measures that we can advise the patient, but before we go through that, we need to know more about the condition. We need to know what does that mean, dyslipidemia. Just in simple words, it means the blockage of lipids, as we can see here in that image for illustration, lipids that's actually blocking the blood vessel, which by time or over time, it will, coming partially blocking the area or the blood vessel or completely blocking it, which could lead to the serious complications or serious cardiovascular diseases such as myocardial infarction, for example. So what exactly happens? What happens is that the movement of the monocytes into the space could actually, after some time, becomes macrophages. And the macrophages oxidize the LDL, which is a type of the cholesterol, the low density lipids. And after oxidizing it, it actually starts to build up this kind of lipid-rich core. It's not only about the lipids, it's also about the inflammatory process or procedure that is involved in the dyslipidemia. So after some time, this lipid-rich core could rupture and causing or initiating the clotting cascade with platelet aggregation. So it's a process of causing or forming thrombus as well, which is a coronary syndrome. So this is a little bit more about how the dyslipidemia or how the high cholesterol levels happen and how it's related to the cardiovascular diseases. So from there, we can talk about the non-drug measures that I can give to the patient to help him before starting medication. So this is usually the first step. For example, the physical activity, exercising, for example, smoking cessation if I have a smoker, for example, stress management, or what we call DASH diet. It's a special diet. These all are recommendations that we can suggest to a patient in order to help him before starting on medication, cholesterol medication. Okay, so in order to do that, would like also to give you a case study about dyslipidemia so we can understand more about the dyslipidemia chapter, how we can implement all the information into that case, and we can take it from there. So we have here a patient, DJ, who is 52 years old male, who is a patient of your pharmacy. The medication that he takes is hydrochlorothiazide 25 milligram once daily. And he's also on ramipril 10 milligram once daily for hypertension. His blood pressure is 142/87. He is not smoker, and he drinks about 2 beers a week. And the cholesterol levels is, as you can see here, the total cholesterol 5.5. The high density lipids is 1.4, which is here the good cholesterol. So the higher the number here is better. And the low density lipid, which is the bad, we call it the bad cholesterol, is 3.5. And also we have the triglycerides 1.5. So I need to look at that case, and for sure, from what I can see, there's something wrong here. He has a high blood pressure, although high blood pressure measurements, although he is on blood pressure medications. He is drinking beer or alcohol, but it's not like too much, but we can consider that as well. And also the age as well as the cholesterol levels. So I need to know what are the targets? What are the targets that a healthy person should be on? For example, the low density lipids should be less than 2. For example, the high density lipids, which is the good cholesterol, should be more than 2.6. So these are, from what I can see here from the slide, I can tell that there is something wrong. He has high cholesterol levels. So if I would like to assess that patient, what should I do? This is definitely something I will explain to talk about the Framingham risk score, which is a score that gives me an idea, like a 10-year risk score, an idea about the probability of that patient to get cardiovascular disease that we can actually discuss later in the next slide.